Thanks, Tommy. It's really interesting talk. So we're going to start off with the first question from Peter. At what age would you think elite level young GAA players should be asked to choose between sports?
Yeah, it's a great question. Ultimately, it's hard to say definitively. Like you need to consider the individual case. How many sports are we talking about? Do the two sports cross over? Are they quite different? In reality, if we're talking about, I think I mentioned Gaelic football there, did it? You're probably thinking after minors, so that kind of under 18 age when you're really starting to get into the nuts and bolts of the sport, and you want to start to specialize in order to, I suppose, advance as much as possible. Obviously, there are outliers, and there's people that have gone further than that and gone longer than that. But as a general rule of thumb, give or take about 18 years old is when you're going to start to specialize to try and, I suppose, develop as best as you can in that particular sport and dedicate as much time to it to optimize your performance, but also then to, I suppose, to ensure that you're not doing too much and too many other bits. But obviously, there are outliers along with that as well.
Okay, thank you. Question from Sergey. Do you have any strength and conditioning plans that you would share for teenagers?
Yeah, absolutely. I suppose we kind of briefly spoke about that and mentioned some ideas in the talk itself. We spoke about the importance of, I suppose, seeking professional guidance. And that's where maybe touching base with a local SSC or coming into the clinic is going to be beneficial there. Rather than kind of a generic program, you want probably something a little bit more specific and tailored to the individual, to their training needs, to their sport, and then to the injury history if there is one as well. So I'd be reluctant to go something too generic, but at the same time trying to reach out maybe to people around you and or coming into the clinic perhaps to get something put in place.
Okay, thank you. Now there's a question here, and we were just talking about it. It's from TY. He was asking about when players are in small to medium schools, and I imagine it means that they're playing a lot of sport in one school and a lot of teams. How can you monitor them to avoid them overtraining and burnout or injury?
Yeah, that's a tough one. Like if there's a small club or a small school, I suppose the talent pool is inherently going to be smaller. Therefore, the same people have to play for multiple teams, perhaps multiple age grades, multiple sports. That can be challenging. I suppose the most important thing is the player and I suppose the parent and coach's relationship and trying to make those communication channels as open as possible so that there is a link between everyone and monitoring that. So I would say first and foremost, communication is the most important thing. And then just, I suppose, asking the athlete, how do you feel? During periods of a growth spurt, that's when you might kind of try and reel in the training a little bit and reduce the training load a little bit. Maybe that's where you could focus a little bit more on strength and conditioning activities or not as much heavy load on the pitch. There are other things you can do in terms of, I suppose, monitoring training in terms of maybe the minutes on the pitch or how much training hours you're doing a week as a slightly easier tool to monitor, and just making sure that that's not peaking or spiking in certain points of the year and stays a little bit more consistent, but also then having periods within the year and within the week, within the month even, where there's going to be slightly lower periods as well to facilitate rest.
Okay, thank you. Question here from Petra. Now, this is more of a general question about how much pain should be tolerated after running. Normally it gets better after 2 to 3 weeks of doing moderate exercise. Is it better to continue running, or is it better to do light exercise and then try and go running again after 2 to 3 weeks?
Yeah, well, I suppose first and foremost, you have to consider, why is your knee sore?
Yeah.
Ideally, you're not ever really exercising and or running through pain. Pain can act as an inhibitor. It can, lead to obviously more pain or perhaps worsening of the injury or the underlying injury. So ideally trying to get to the bottom of why the knee is sore and then rehab that and get back to running pain free. So I'd be reluctant to encourage anyone to run through pain at any kind of age or level, really. So try and get to the underlying cause, see a physio or someone and try and get on top of it that way. If you can find other modes of exercise in that period that are pain-free, maybe less loading or less weight-bearing activities, absolutely work away with them. But I would still advise to try and get to the underlying cause of it and rehab that and get it better before really pushing on the exercise or training through pain.
Yeah, Thanks, Tommy. This is the last question now from Paul Wallace. He's how can a 17-year-old plan for post-surgery for a ruptured ACL operation due this month? What strength and conditioning could be done during rehab?
Okay, sorry, say that one again.
So he said it's a 17-year-old. He's having an ACL. He's got a ruptured ACL, and I think they're asking what strength and conditioning should they be planning to do afterwards. But I'd imagine that as well would be under the consultant as well.
Yeah. So the consultant is going to have some clear guidelines. I guess it depends on at what stage you're at. You know, further down the track, you're going to be able to do a lot more. In the early stages post-op, you're probably not going to be doing as much, but depending on where they're taking the graft from, whether it's the patella tendon graft or a hamstring graft, that's also going to influence it. But in reality, we want to try and keep the knee as calm and happy as possible. So not doing any activities that aggravate the knee, and then trying to build up strength in the localized area, the quad, the hamstring, the glutes. Again, that might be a bit more dependent on the graft type, but trying to build them up in pain-free movement. Initially, that might be a little bit more isolated, leg raises, etc. And then that progresses into more your generic kind of strength activities, like your squats, your single leg squats, etc. He said he's post-op though, didn't he?
I think he's having surgery in 2 weeks' time. So he was
yeah. So pre-op, I suppose the goal is to again go in with the knee happy. So there's it's minimal effusion or swelling in the knee, full range of motion. Do what bits of strength training you can, provided depending on how tolerable the knee is to it. Typically at this point, if he's 2 weeks pre-op, usually the knee is in a pretty good place and you can actually do quite a bit of loading on it. Then post-op, obviously that's going to reduce again because there's going to be some swelling and inflammation and stuff. So usually the 2 weeks post, you can do a good bit of work. The key thing is, again, not to aggravate the knee in the process. So try and build strength as best you can. Again, specifically around the kind of quad is going to be the big one there, without annoying the knee in the process being a key factor there as well.
Lovely. Tommy, thanks very much for joining us tonight. So